million Australians live with a chronic health condition. That's more than half of our population. Peak medical bodies say these patients need longer consultations to stay on top of their health, but costs is keeping them away.
Doctors and advocates side by side in Parliament House.
I've lived with Parkinson's for 12 years, and the key to my health is the fact that I have a great relationship with my GP and I have access to a specialist.
Spending the time to talk through symptoms, key for patients with chronic conditions.
The GP who knows you, who understands your baseline, your history, your subtle changes, is the only difference between early intervention and a hospital admission.
Incontinence, depression, anxiety, trouble swallowing, trouble eating, fatigue. These are all symptoms that people with Parkinson's can have, and they require long conversations with their GP.
20 peak bodies have co-signed a letter calling on the government to increase the Medicare rebate for longer consults.
Patients who need this care are often finding it unavailable or unaffordable because the per-patient Medicare rebate decreases as consultations get longer.
At the moment, a patient will get about $85 back for a consult over 20 minutes and $125 if they're at the GP for over 40 minutes. A 40% increase would almost double the money going back into patients' pockets. Advocates adding higher rebates could keep patients out of emergency departments.
Fund the consultations, prevent a stroke, save a life, save money.
In a statement, the Health Minister didn't respond directly to this push, but said bulk billing incentives are working.
Not all long consultations can be bulk billed, and that's why we're calling for these increased patient rebates.